This year marks 40 years since the first cases of AIDS were reported. In that time, more than 77 million people have become infected with HIV, and over 34 million have died from AIDS-related illnesses. 20 years ago, HIV seemed unbeatable. But over the course of 2 decades, thanks to unprecedented global activism and solidarity by many partners, extraordinary progress has been achieved. One of the game-changing moments on that trajectory was the creation of the Global Fund, born out of this global movement and rooted in the G7. In those 20 years, AIDS-related deaths have dropped by 65% in countries where the Global Fund invests. Together, we have proven that a united world led by strong communities, with leadership of implementing partners, generosity of donors, the support of technical partners, can drive even the most challenging infectious diseases into retreat. But COVID-19 now threatens to derail decades of progress for HIV, but also for other diseases such as tuberculosis and malaria. The pandemic has put an additional burden on already overstretched health systems, and the socio-economic impact has been devastating for the poorest and most marginalized. For the first time in the Global Fund's history, key programmatic results for HIV have declined. In 2020, the number of people reached with prevention services declined by 11%. More babies were at risk of becoming infected with HIV at birth because their mothers were unable to access preventive treatment. COVID-19 has exposed the most vulnerable to even greater risks as lockdowns and restrictions to curb the new pandemic cut access to life-saving HIV treatments, tests, care, and prevention services. But these unprecedented times have also seen extraordinary resilience. Supported by the Global Fund, communities responded with imagination and determination to support people on antiretroviral therapy to sustain access and continuity of treatment, despite the disruption from the new virus and from lockdowns. In fact, in 2020, the number of people accessing antiretroviral treatment actually increased by 9%. The Global Fund has also supported important health innovations like co-testing for infectious diseases, COVID-19 and HIV simultaneously, multi-month dispensing of antiretrovirals, self-testing, and digital tools for prevention and treatment support. Together with partners, the Global Fund joined forces to create the Access to COVID Tools Accelerator, ACT-A, a mechanism to enhance collaboration and coordinate the global response to COVID-19. Having deployed over $4 billion in addition to our funding for HIV, TB, and malaria programs, over $4 billion to support countries' COVID-19 responses, the Global Fund has been the primary channel for providing grant support to low and middle income countries for COVID-19 tests, treatments, including oxygen, protective equipment, and critical elements of health system strengthening. Essentially, support for everything except vaccines, which are provided through COVAX. Throughout this crisis, countries have leveraged the investments made in health systems to fight HIV, TB, and malaria to better respond to COVID-19. The capabilities to prevent, detect, and respond to diseases like COVID-19 and future pathogens are essentially the same capabilities as needed to fight existing pandemics such as HIV. We are tremendously grateful for the support and confidence of our donors, like Germany, whose generous support has helped ensure that the Global Fund can continue its mission and further support partner countries during this crisis. Without this support and without these interventions, the situation would have been much worse. But the reality is, we still need to do more. We are far from through this crisis. There will be no global recovery from the pandemic while some are still left behind. We have the tools to fight COVID-19. We must ensure that everyone, everywhere, has access to those tools. We have seen again and again that pandemics thrive on and exacerbate inequities. While we have made great progress on HIV in increasing access to treatment, in increasing the effectiveness of prevention activities, structural and social inequities, stigma, discrimination, and criminalization continue to fuel HIV infections and deaths. If we want to beat HIV and if we want to beat COVID-19 and we want to protect against future pathogens, we must recognize and tackle such inequities. The Global Fund is the largest multilateral investor in grants for health and community systems. In fact, we've increased investment nearly 8-fold in programs to remove human rights and gender-related barriers to accessing health services since 2016. These investments are not only critical to address the earlier pandemics, HIV, TB, and malaria, but also new pandemics like COVID-19. These investments will also ensure more equitable access to health and will be the strength, the foundation of our response to future health emergencies. Germany has demonstrated incredible, consistent leadership in global health, and sustained leadership under the new government and via next year's presidency of the G7 will be critical to building a more equitable and healthier world together.